Hello everyone, my name is Adam Neiman, and tonight I'll be discussing Epic, which is an integrated healthcare software company. Did all of you know that the government has mandated all healthcare providers and hospitals that they start using electronic medical records by the year 2014? This speech will provide you with information as to why hospitals are moving towards electronic documentation. I will provide information on Epic Systems, a leading provider of healthcare software. This will include the history of Epic. It will include the applications and products that it offers, as well as how the products and applications are used in healthcare today. And finally, I will share some of my own personal experiences with working with Epic. Now that I've shared with you what I'll be discussing tonight, let's get started with talking about why there's an increased need for healthcare software in the world today. One of the main reasons that there's an increased need for integrated healthcare software is that the government mandated in the 2009 HITECH Act, which stands for Health Information Technology for Economic and Clinical Health. This act states that healthcare providers will receive incentives for using electronic medical records. According to the Centers for Medicare and Medicaid Services, otherwise known as CMS, these incentives or payments to eligible physicians and hospitals as they adopt, implement, upgrade, or demonstrate meaningful use of a certified EMR technology. These incentives will be offered up until the year 2015. If providers, medical providers, or hospitals choose not to implement an EMR system, then penalties can be assessed. An example of this type of penalty would be Medicare reimbursements to the hospital or the provider could be reduced by 1% yearly if they choose not to implement an EMR system. Another reason that medical providers or hospitals are moving towards using an EMR system are the benefits that EMR systems provide. Such benefits include having the patient information available wherever and whenever it is needed. Additional benefits include allowing collaboration of care between different medical providers, reduce risk of error in patient care, as well as reduce cost due to the decreased use of paper records. Both the HITECH Act and the benefits of having an EMR system has led to the development of companies providing integrated healthcare software. And Epic Systems is at the top of the list of these type of companies. Now that I've discussed why healthcare providers are using EMR systems, I will discuss Epic's history. Epic was founded in 1979 in Madison, Wisconsin by Judith Faulkner. Judith Faulkner was a computer programmer, and she started a company called Human Services Computing, which would later become Epic Systems. This company did number crunching for government agencies and medical research, and the company became named Epic Systems in the mid-1980s and started to focus on creating software to track inventory as well as labor costs in medical industries. In 1992, Epic created a Windows-based electronic medical record called EpicCare. It is from this product that the company exploded in growth. It has continued to expand by starting web-based healthcare in the late 1990s. By 1997, it became the largest EMR system in the world. It has continued to grow into the 21st century. And it is estimated by next year that 127 million patients, or roughly 40% of the US population, will have its medical information stored in an Epic digital record. This growth is due to the company's strength of its product, its services and support that it offers, and the increased demand for electronic medical records. Epic has recently made its debut in the Cincinnati and tri-state area as the majority of providers, especially hospital systems, have moved to EMR systems provided by Epic software. Now that you have a basic background on Epic, I will discuss the products available from Epic. Epic is an integrated software system. This means that there is a central database that supports functions related to patient care. This includes such things as registration, scheduling, clinical systems for providers, systems for pharmacists, labs, radiology, as well as billing. Epic has applications such as ASAP for the emergency department, Stork for its OBGYN product, Cupid is its cardiology product, ADT for its admitting and registration product, and Resolute for its professional and hospital billing product. To help you better understand the Epic system, let me walk you through how it affects one patient coming in for a surgical procedure. This patient will go through scheduling, admitting and registration, the operating room, anesthesia, the patient will see various physicians, they'll have their labs drawn, they'll go to radiology, and finally they'll have their services billed. And all of these aspects of this patient's surgery have an application in Epic. These applications are integrated to work towards a better experience for the patient and the hospital and the medical providers. This leads to more cohesive care for the patient. Now that I've shared with you the applications that Epic offers and how they are used in healthcare today, I'd like to talk to you a little bit about my personal experiences with Epic. I currently work for Information Systems Department for St. Elizabeth Healthcare. I've worked there since 2010. I currently support our Patient Financial Services Department, where my daily job responsibilities include workflow analysis. I design, build, and optimize the Epic Resolute Hospital Billing application. And to obtain my certification, I had to attend 2 separate week-long training sessions at the main campus of Epic in Verona, Wisconsin, which was on the TV, but not now. Once I attended the training class, I had to take 2 tests, pass 2 exams, and then I had to complete a lengthy project before I was able to get my certification in Resolute Hospital Billing in July of 2012. I currently enjoy my job. It's extremely challenging, and what makes it so challenging is the ever-changing technology. It almost seems like it changes daily. To conclude my speech, I've discussed why there is an increased need and demand for integrated healthcare software. I've shared with you the mandates the government has placed on healthcare providers to implement EMR systems like Epic. I've shared with you the history of the Epic systems, the integrated software applications they offer, as well as sharing my personal experience with working with an Epic application. I hope that you know now the important role that Epic Systems plays in providing integrated healthcare software to healthcare providers and hospitals today. Thank you.